Hello and welcome again to class. Thank you for staying tuned. This is another edition of Poultry Science. Thank you again. I must say thank you for always tuning in to the class and also learning. Thank you for subscribing, for following, and also sharing. Now, if you remember the last class, the last lecture, I talked about infectious bronchitis. And in fact, while I was talking about it, I was kind of making a mistake trying to call infectious bursal disease. And then I said I was going to treat infectious bursal disease. And I'm making true the promise. So the next title here, topic today is infectious bursal disease. Infectious bursal disease is well known as Gumboro disease. Now, why is it called Gumboro disease? It is because our story has it that it became well known in a particular place in the United States called Gumboro. So it has picked up the name and it has gone with the name ever since. Now we also have other names for it. Infectious bursal disease. It is infectious bursitis. Now remember I told you this, that in science when you see something ending with T's or tighties, it has to do with the word inflammation. So infectious bursitis or infectious avian nephrosis. Now the word nephrosis may be a bit hard for some. Avian means has to do with birds. Nephrosis has to do with something kidney. Now nephrosis is a non-inflammatory, refers to a non-inflammatory, ordinarily non-inflammatory disease of the kidney. However, in this case, infectious avian nephrosis is actually another name for infectious bursal disease, popularly known as Gumboro disease. Now, what's the causal agent? The causal agent is the binary virus. Again, we'll come back to diseases that are caused by viruses. Viral diseases, more often than not, are not treated, they are managed. Yes, there are some cases where they can be treated and you get a clear-cut healing or cure for the animal, but in some other case you have to just manage the animal or treat for secondary infection, in which case they suppress the immunity of the animal such that exposing the animal, making them susceptible, more vulnerable to either bacterial disease or fungal disease, which in fact now does the killing of the animal or weakens them. And this is the exact thing that Gumboro does. Gumboro is actually an immunosuppressive disease. What that means is that its work is actually to suppress the immune system of the animal. So the fact about it is that it has the potential to suppress the immune system of birds that are so infected. Immunosuppressive capacity is its main strength. Now, it's usually among chicken less than 3 weeks of age, more often than not when they get infected. Now, what are the signs or symptoms you may be looking at? The signs and symptoms, generally, like I said previously, you want to look at previous videos, please do. The first thing you notice about birds that are sick is when you come, you give them feed the day they finish, you know the quantity of feed they consume, and then suddenly on the day you come and then they not finished it, you try again and that day you see that it's not the first one or the fluke. The same thing, then you know that the animal is sick. The first thing is loss of appetite, reduced intake of feed and water. Feed intake reduces, water reduces. Now, in the case, that's a general sign for most ailments. Feed intake, water intake reduces. But then for infectious bursal disease, what other things you see? You see fluffy feathers, especially when it becomes a bit advanced on the bird. You see the bird the feathers are fluffy like this. And then other things you see is begin to see water dropping. Now when the dropping become watery, something happens. The feathers around the vent or the anus become wet. And when it's wet, the other birds will say, this is wet, looking kind of attractive to them. They begin to peck. When animals peck, to them, they don't intend to be wicked or to do something bad. They will feel more like, let's help you. In the process of helping, they don't have hands. They are actually causing more injury, causing more hurt, especially in cases where you see blood. In this case, you see the vent wet and they begin to peck. The pecking may lead to bleeding. The bleeding makes the pecking even worse. The animal may die if it's not separated. Now you see the vent becomes wet and pecking happens. If it's not taken care, it will die. Now another sign you see and symptom is listlessness. The animal is disinterested. It doesn't have energy. You put feed, it's not interested. You put water, it's not interested. Listlessness. The same thing happens with humans. You see humans when sick, they're not interested in certain things that ordinarily they'll be interested in. It's one of those things you see. Listlessness is one of those things. Now, there are two cases of immunosuppression that Gumboro that's presented with Gumboro disease that the virus causes. Now presents. Now you see in this case you have the minimal suppressive form and the acute one. The minimal suppressive one, the minimal suppressive and the acute one. Minimal, of course, like the name tells, it's not as intense as the acute. Acute means it's painful, very painful and very severe. Now what are the things you see when you just see? Another sign of it is you see whitish feces and you see depression. Of course, the animal is not interested, it's depressed. On the other hand, when it's going to be acute, you will see these things and you see even more. Number one, you see internal bleeding. If the animal is after death, you do a post-mortem on the animal, you see there's bleeding, which is also called hemorrhage. Another thing is you see infectious, inflamed bursals. Bursals are fluid-filled sac in the internal organs of the animal. Now you see a kind of oedema, a collection of fluid water in the some sac or fluid sac of the body. Now you see lesion. Lesion means like peeling or cuttings around the nostrils and around the bursal of the animal, and ultimately will lead to death. Sometimes 15 to 35% death in broiler chicken less than 7 weeks old. These are some of the things you will see. Now for space and for time, for the length of the video, I'll do this. I'll stop here. In the next class, which is going to be in a few days time, maybe 2 or 3 days time, tomorrow night or tomorrow next, we're going to continue with the mode of transmission, the treatment, possibly, just in quote, and the prevention. Thank you so much for liking. Now, if you have a question or if there is a gray area you don't understand, please type on the comment section, or you can also like, share, and just reach out to me if you have any question. I want to thank you for staying tuned. Let's see you next class. Thank you.